Why, hello, everyone. Thank you for joining us today's announcement. I'm Mike Ellis, Alberta's Associate Minister of Mental Health and Addiction, and with me today is Dr. Nathaniel Day, the Medical Director of Alberta's Virtual Opioid Dependency Program. We're here today to talk about the illness of addiction. Addiction continues to have an impact on our communities, especially when it comes to the tragedy that is opioid overdose. This illness of addiction continues to claim the lives of Albertans, and my heart goes out to all those who we have lost, and families and communities that have been impacted by it. However bleak the situation may be at times, there is hope for people with addiction, as we know the treatment works and that recovery is possible. It is the hope that has formed our response to addiction, and we have made great strides to improve access to treatment to help more Albertans enter recovery. On Saturday, I stood with Premier Jason Kenney as he announced that our government has doubled our commitment by funding 8,000 annual treatment spaces, and we did it 2 years ahead of schedule. This means that over 8,000 Albertans will be able to access life-saving medical detox, residential treatment, and residential recovery services every year. All of this with no user fees. We are building a comprehensive, recovery-oriented system of care that gives everyone access to treatment and hope for recovery. In addition to the expansion of publicly funded bed-based treatment, we have also been expanding access to evidence-based medications. Last quarter, we had the highest level of evidence-based medication dispensing on record, and we will continue to support these interventions. And that brings me to the first part of today's announcement. So Alberta's government is employing a new tool in the fight against opioid overdose. Ladies and gentlemen, this is Suboxone. Unlike the tablet-based version that lasts 24 hours, Suboxone is injected and lasts in a person's system for 30 days, providing stabilization, reducing cravings, and significantly enhanced protection against overdose. That means Albertans pursuing recovery are not required to attend the pharmacy daily to receive their treatment. It means less sleepless nights for parents and loved ones who wait up at night for that dreaded phone call. And it means that our homeless and our vulnerable population don't need to worry about destabilizing as a result of not taking their medication. Starting immediately, the Suboxone injection is fully funded and available through the Public Benefits Plan and the OUT-GAP coverage program like any other medication. The addition of Suboxone to the publicly funded formulary and its removal from special access will significantly reduce barriers to this medication. Recovery-oriented care is about providing options to Albertans with addiction, and this option will save lives and support recovery. In addition to covering the cost of Suboxone, I'm also announcing that Alberta's government is providing Alberta's award-winning virtual opioid dependency program with an additional $1.4 million annually, bringing our total increased funding to $6.4 million. Alberta is the first jurisdiction in Canada to achieve treatment on demand. This means that any Albertan with an opioid addiction can receive treatment on the same day with no wait list, with no fees, anywhere you live. The $1.4 million will support the virtual program to create low-barrier harm reduction division that will do rapid assessments and provide enhanced case management for vulnerable clients. With this additional funding, they will be able to serve more Albertans, build more relationships, and ensure that more people reach their goals in recovery. And with that, I would like to welcome and congratulate Dr. Nathaniel Day to speak and say a few words. Welcome, Doctor. Thank you.
Thank you, Minister Ellis, and hello, everyone. Today is a great day for addiction treatment in Alberta. As Minister Ellis mentioned, Alberta is leading the nation with our virtual opioid dependency program, where we are able to provide same-day access to evidence-based medications anywhere in Alberta. We recognize that if we're really going to tackle opioid addiction, Treatment needs to be as accessible as possible to as many people as possible, no matter where they live. In June 2020, Alberta's government announced a $4 million increase for the virtual opioid dependency program, and we've been hard at work putting that funding to use. Since June, the number of people that we've been able to serve has increased by 60%. Our virtual program has served people in over 270 communities all across Alberta. And as of September, there were about 1,100 active ongoing care clients in our program. Not only are we helping people, we are measuring significant improvements in people's lives. Our program shows decreased overdoses, decreased high-risk behaviors like injecting and needle sharing, decreased emergency department utilization and hospital admissions for any reason, and fewer criminal justice charges. As our clients recover, they also show increases in their employment rates. With the additional $3 million announced today, we are going to be able to provide a more comprehensive treatment to more Albertans with the establishment of a low-barrier division. The low-barrier treatment division will be responsible for ensuring that vulnerable Albertans are receiving comprehensive case management, follow-up, and referral to other supports that they'll need. This is going to dramatically increase our capacity to help Albertans access life-saving medications no matter where they are or what resources they have. I'm also very excited today with the addition of Suboxone to the publicly funded formulary and the OAT gap coverage program. Suboxone is a 30-day injectable version of the gold standard opioid treatment medication Suboxone. This medication is going to revolutionize the way that addiction medicine is approached in Alberta by providing a new and innovative tool to treat opioid addiction and overdose. Suboxone stays active in a person for 30 days, providing stabilization, reduced cravings, and significantly enhanced protection against overdose. Alberta's government is leading the way between the expansion of evidence-based medications and an increase of over 8,000 annual treatment spaces for Albertans. I'm excited to be part of this and look forward to watching this great work continue. Thank you.
Thank you, and we'll now go. We've just got the phones for questions today, so just a reminder to media, if you can please state your name and your outlet, that would be fantastic. Operator, can you please put through the first caller?
Anna Yonker, Edmonton Journal.
Hi. I was hoping you could kind of go over how someone gets Suboxone. Like, where do they go? Are there any requirements that they have to meet to actually get this injection?
Yeah, great question. So with any evidence-based opioid agonist therapy, a person obviously needs to be diagnosed as having an opioid use disorder. With the injectable form, we need to make sure that they're not allergic to the medication. So we usually need to start that person on an oral form to make sure they can tolerate it and that it's effective. And then we can go ahead and get the injection. The injection can happen at clinics, so people who are involved with face-to-face programs can certainly get the treatment there. But it also can happen at the pharmacy. And so we, in our program, have partnered with many pharmacies all across Alberta where the person is assessed, gets a prescription for the treatment, and then receives the medication at the pharmacy.
Thanks. And Anna, did you have a follow-up?
I do, thank you. BC and Manitoba currently have drug checking services that would allow individuals to test if their drugs are lethally toxic. So I was wondering where the province currently stands on also implementing these services.
Yeah, thank you very much for the question. Right at this time here, we're exploring all options. My department is examining that, and I might get the doctor to supplement. But at this time, no decision has been made. We're just exploring what the evidence is on this particular issue. Thank you.
Thanks for that question. I think in the interim, it's important for everyone to recognize that fentanyl contaminates much of the drug supply. And so much like, being careful about safe sex, it's important for people to assume that if they're using illicit drugs, that there's a high likelihood that there could be fentanyl in it. I would add to that in my clinical experience, by and large, people who are using opioids from the street know that they're using fentanyl and unfortunately are tolerant to fentanyl and are looking for fentanyl.
Thank you. Operator, can you please put through the next caller?
Donna Mato, CTV.
Hello, my question is regarding a public service announcement from Alberta Health Services today about a spike in EMS calls. Can you just explain how this announcement and how this new drug will help to decrease EMS calls in our big cities?
Yeah, well, thank you very much, and certainly I welcome the doctor to supplement anything here that he would like. Yeah, I mean, we've been working with the Edmonton Police Service. We have been working with, just as an example, we work in the Edmonton Police Service, the Alberta Health Services, the paramedics. We're trying to figure out ways to help people figure out new tactics. As an example, as you probably heard me mention before, 70% of overdoses are actually occurring not in the downtown area, but actually outside of the downtown area and more so the suburbs. This is where the virtual overdose dependency program comes in. This is where the DOORS program comes in. We think that it's extremely important that people, if they are going to be using at home, using alone, that they download that app and make sure that EMS gets dispatched to their house in order to save their lives. You've heard me say this before. This crisis is a very complex issue. There is no one single solution to this problem. We're certainly exploring all opportunities. The virtual overdose dependency program is just another example of hopefully the helping people on a pathway in that recovery-oriented system of care.
Yeah, I would love to add to Minister Ellis's comments. The reality is that anyone who's using alone really should download the DOORS app if they're in Edmonton and Calgary, so as to use that tool to help prevent overdose. That being said, going specifically to the question about how this medication can help with opioid overdoses, I would like to add that just the way that this medication works, so that the medication that's active with the Suboxone shot is called buprenorphine. And buprenorphine, when it gets into a person's brain, it actually is able to go to the receptor system where opioid addiction works, and it's able to latch onto those receptors, and it binds tightly to those receptors. And when it binds tightly, amazingly, incredibly, what it does is it actually turns those receptors on enough that it takes away opioid sickness, reduces craving for drug, and has the potential to block overdose. So we would expect a person who's receiving the Suboxone shot not only to feel comfortable in their own skin, able to function without using, and so we would expect use to go down substantially. But on top of that, if a person does use while they've got the Suboxone shot in their system, we would expect their risk of overdose to be substantially less.
Thanks. And Sean, did you have a follow-up?
Yeah, I do. I just wanted to ask about the money side of this. What will this cost? And is there a chance that this will actually save us money on EMS calls and hospital admissions?
Yeah, I mean, obviously that would be the hope. I think the doctor was able to articulate that quite well just a moment ago. I think in my remarks I talked about the additional funding for the virtual overdose dependency program. But maybe the doctor might get him to supplement a little more of the details surrounding the costs of Suboxone and the possible impact on the healthcare system. Thank you.
Yeah, so again, appreciate the question. The evidence is very clear. If people are able to enter into recovery and start evidence-based treatments, what we see is a decrease in overall system costs, and it's across the spectrum. So across jurisdictions where we get people started on treatment, they're in hospitals less, and in fact, that's something we see in our program, less emergency visits, less hospitalizations. We also see less involvement with the criminal justice system, which saves time and money. I would expect that the healthier we can get our population, the more we'll be able to save, and the more these initiatives pay for themselves.
Thank you. Operator, can you please put through the next caller?
Catherine Gurkowski, Alberta Today.
Hi. I'm wondering how many people you expect will be able to access Suboxone with this announcement.
I think that's a question for your program.
We hope that as many people as possible access Suboxone. So our hope would be that every eligible person consider Suboxone, speak with their physician about Suboxone, and use Suboxone. This is a medication that we're seeing initial very good success with across the spectrum. Clients that I have who have been in the sort of early phases and trying this medication are very pleased with it and find that they are achieving stability that they didn't think was possible before. If I were worried about my own child who is using opioids, I would want them to get onto Suboxone. And the reason is that the medication's there. It's there for a month. There can't be a bad day or a stressful day where they stop using the medication or they bounce back into use. The medication is very protective and really an outstanding tool that I'm so pleased that we now have access to.
If I could supplement as well, Doctor, thank you so much. I mean, the Suboxone tablets, which of course came before the Suboxone, I mean, that was a daily dose, and to have this medicine that can, and I think the doctor articulated himself quite well, that can last in a person's body for 30 days, again, to amplify all those positive attributes that the doctor just already mentioned, I think is fantastic, and I think it reduces the risk. Of course, when you're taking a daily tab, if somebody misses a daily dose, then obviously there's some complexities in that. So, again, really excited about this announcement.
Catherine, did you have a follow-up?
Yeah. Well, I wanted to follow up on this public service announcement about the increased EMS calls and some of the advice is to check the potency or strength of the drugs. I'm wondering, obviously an investigation needs to be done, but is there anything that we're seeing in these local contexts? Is it that the drugs on the street are too potent? Is it that they're being mixed with other substances such as amphetamines? Like what is leading to this spike?
I'd like to get the doctor to supplement. I mean, as many of you already know, I mean, I certainly worked as a law enforcement officer for over a decade on the streets. Look, I mean, drugs are dangerous. All drugs are dangerous. And I think when you're talking about whether the drugs have fentanyl in it or not have fentanyl, I think the doctor was able to articulate himself quite well in saying that I think anybody who's using has to make the assumption that fentanyl is in it and take the necessary precautions. And so maybe I'll get the doctor to supplement that.
Yeah, thanks for the question. Surely people are using variable products that are contaminated with fentanyl and carfentanil. That's no surprise. I think for our program, when we do drug testing, we see fentanyl in opioids that are submitted in patient samples in virtually 100% of the drug tests that we do where a person's using opioids. We would encourage everybody, I would encourage anybody who is using illicit drugs to recognize that there's a high degree of likelihood that they're being exposed to fentanyl or carfentanil, and to be cautious. Download the DOORS app, seek treatment. Treatment is effective, it saves lives, and the best hope that we have, in my opinion, is that we get people started on safe, effective treatment medications that will actually eliminate their risk or reduce it substantially at having an overdose, at dying. And what we see is just tremendous improvement in people's overall quality of life. We see people who are returning to work, who are resuming their relationships with their families, who are just doing incredibly well. And so if I had any message for the general public, it would be that it is that treatment works. It is possible to get the life back that you want. And in Alberta, unlike any other jurisdiction that I'm aware of, a person can actually get started on treatment today by calling a toll-free number and at no cost to themselves.
Thanks, everyone. That's all the time that we have today. If there are any other questions, you can follow up with me directly. Thank you.